It's Local Edition. I'm Brad Pomerance in Los Angeles. Today we are joined by Hector de la Torre. He was a member of the California State Assembly, but he is currently the Executive Director of the Transamerica Center for Health Studies. And you've been looking at healthcare reform efforts all the way back to when you're in the Assembly and now through the Affordable Care Act and the American Health Care Act.
Yes.
That's what it's called. Known
AHCA.
Obamacare, Trump Care. As we speak today, we know the House has passed their version, the Senate's percolating on their version. What's your sense of what's going on in Washington?
Well, the Senate has to work on a version that saves more money than the House version because they're using a budget process to do this. They're not doing regular legislation for a lot of political reasons.
Well, they would need 60 votes if they went the regular route. That's what the Democrats did, for example, in 2009, I believe. Now they're looking for 50 or 51 votes.
Exactly, with 51 votes. And in order to get the 51 vote process, they need to save more money than the House did. So that is where it gets a little tricky because a lot of the senators are balking at some of the things that were done in the House version.
Yeah, and let's talk about that because, look, the headline, I think it's fair to say, is that the Congressional Budget Office has said that if the AHCA passes next year, we'll see 14 million lose coverage. And within, I think it's 10 or 8 years, 23 million will lose coverage.
Yes.
I mean, that's a tough headline for proponents, I would presume.
Yes, and the CBO report had many other negative impacts to our healthcare system, namely a significant loss of resources for hospitals and clinics all across America because you would have less coverage for individuals who are going to those hospitals and clinics. So whether you're a rural congressman or an urban congressman or Democrat or Republican, it would really have a severe impact across the country.
And what's remarkable, one could argue, is that when you look at these impacts, the impacts seem to more disproportionately hurt those that live in red states as opposed to those that live in blue states.
Well, one thing that we know, getting back to the Senate, is that 20 senators, Republican senators, come from states that expanded Medicaid.
Right.
So
and many Republicans.
Yes. So 20 of the senators, Republican senators, that are going to have to vote to do this are from the states that expanded Medicaid, which means they are purposely rolling back coverage in their own state. And all politics is local.
Right. And I think about Nevada, for example. Republican Governor Brian Sandoval, he expanded Medicare, and he's contacted the president. He had been contacting him. Please don't do this. Yes. And here we are today.
Ohio,
John Kasich.
Or Kentucky, the leader of the Senate, Mitch McConnell, comes from a state that expanded Medicaid.
Right.
So there are a lot of them that are saying you can do the reforms on the health insurance side, but the Medicaid part, we need to be really careful because they have seen this expansion in coverage.
Well, they're saying that, but it doesn't seem, at least on the House side, it doesn't seem as if those pleas have had any impact.
Well, senators tend to have a broader view.
Okay.
I think the Founding Fathers had that genius idea
I hear you.
of balancing the two. So the House has a small district. They're very parochial. The Senate usually has a little more balance, Democrat or Republican, because they're representing a whole state and everything that's in it.
But for argument's sake, let's say the Senate passes something, and that something is less to the right than the House version.
Yes.
Well, the House version barely made it through because they were able to cobble together folks that were on the right side of their caucus.
So there are 4 more steps still to be had as we sit here today. So the first is getting it out of the Senate, some version of a bill getting out of the Senate. Then it has to go to conference. The 2 houses have to come together and negotiate one bill. That is going to be very tough because of these differences that we're citing. Then that version has to get voted on again by the House and the Senate.
Right.
So there's 2 more votes still to come even after the Senate gets it out. And then the last step, obviously, is the president actually signing it. So all of this has to happen by October 1st.
Let's presume that we don't see a bill survive for whatever reason. There are many prognosticators who believe we will not see the American Health Care Act survive. Then we remain under the Affordable Care Act, Obamacare. But what we've seen over the last year, many believe that the current administration has been taking steps to undermine the ACA. But if that winds up being the law that's still in place, where do we go from here? Because we have a law that's been eviscerated.
So the law will still be in effect if nothing
Right.
is changed legislatively. However, there are over 1,000 instances in the Affordable Care Act where the Secretary of Health and Human Services can, shall, will.
Right.
The Secretary of Health and Human Services has a lot of control
Right.
over what happens, and Secretary Price is no fan of the Affordable
Right,
Care
I mean,
Act. So
for-
he
yes.
can do changes. He can reduce enforcement. He can reduce payments that are under the Affordable Care Act on his authority.
And what we know, for example, I believe within the first week of the new administration, they chose not to enforce the individual mandate. Well, without the individual mandate, we don't have enough people in the insurance pools to even out the financial risk. And so that's part of the reason, as I understand it, we've seen the current exchange market struggle.
Yes. Well, the first executive order that President
Right.
Trump signed related to health care kept the mandate, because you can't get rid of that without legislation. What he did was he told the IRS to basically look the other way on the tax penalty. So that's where we stand. We're in this weird nebulous area. But if there is no tax penalty, then there is no mandate, essentially. But I don't know that people know that yet. And I think in most instances, people would prefer to have the coverage
Right.
than pay the penalty.
So let's bring it home and talk about California. Assuming that we live under the Affordable Care Act, that arguably has been undermined, how does California's insurance market march forward? And for the purposes of our conversation, I'm going to presume that the single payer bill that has been proposed does not survive.
Okay.
I'm just going to make that argument.
So Covered California has done very well. It's
Okay.
one of the models nationwide. We have competition up and down the state, multiple insurers in every market, and so it's working well. The challenge will be at any point in these next several years if the subsidies, the tax subsidies that are part of the Affordable Care Act,
Both for Covered California.
Yes.
80-90% of us who are in Covered California.
over
get a
80%
Yeah.
of the people in exchanges get some kind of subsidy.
Right.
So the subsidies are the key. They can do whatever they want around the margins, but the subsidies, the money has to keep flowing so that that insurance can be affordable for folks. They've earned it. It's based on their income levels, and they should get it.
So can the administration decrease the subsidy without the American Health Care Act?
Without legislation, no, because Congress funds.
And Secretary Price of HHS cannot change that as well?
No. Again, it's a dollar issue, and all dollar issues come from Congress.
But so can the Congress defund without passing the American Health Care Act?
They could do it in a budget bill, just with not even referencing the American Health Care Act. I doubt that, because then you're really doing nothing without replacing it with anything. They've said all along they want repeal and replace, and taking that money away doesn't replace anything.
He is Hector de la Torre. He is the Executive Director of the Transamerica Center for Health Studies. My name is Brad Pomerance, coming to you from Los Angeles. It's Local Edition.